My advice to anybody who has not been vaccinated is get yourself vaccinated. COVID-19 is not a joke. It does not respect age. Whether you are young, we have lost patients who are in their 20s. We have lost patients in their 60s. So COVID-19 is not a respecter of age. You can get severe illness.
Adverse events? Yeah, we have a setup because this is a clinic. So we have a setup where we can be able to offer emergency care for any adverse events. Fortunately, since we started, we've not had any, but we have a setup inside. Actually, an emergency unit that we've put inside to take care of that. And also, we are supported by ambulances. You can see ambulances around when we need to evacuate someone for emergency care. Yeah. As you can see, there's a tent here where people come in, they sit there, and we take them through the whole process. We tell them about what to expect. We prepare them actually, and those who we feel are not ready for it. For example, if someone is already exhibiting signs and symptoms of that are related to COVID, then we exclude them and explain to them why, and ask them to come back when their symptoms have subsided. I was among the first people to take when we started this center, and I think it's a good idea that we have as many people as possible vaccinated. And you've seen from the countries that have gone ahead of us and have had quite a huge mass of the population vaccinated, they are already showing reduced numbers of COVID infection and deaths, which is desirable. And we want as many people as possible to be vaccinated so that we can have these numbers reduced as well. Lists, we were looking at 58 years and above, and people who have direct interaction with for example, our lecturers have direct interaction with students. But now, because kind of like we've vaccinated almost all of them, so now it's open to anybody who is 18 years and above. Apart from those who, like I said, who are pregnant and those who are exhibiting symptoms of COVID. Yeah. When you come to the vaccination, we will tell you actually in advance that there are some side effects that might come. You might exhibit some side effects, and what is expected and normal is something like fever, headache, muscle pain, joint pains, maybe pain on the injection site, to a small extent maybe nausea, but to a very limited degree. That is expected. Yeah.